Welcome to today's program titled Case Study, How New Technology Helped a Major Insurer Thrive on HealthCare.gov. At this time, all participants are in a listen-only mode. Later, we will conduct a live question and answer session. If you wish to ask a question live, you must be listening to this webinar on the telephone at that time. For those of you who are logged into the web presentation, you are encouraged to submit questions throughout the conference by selecting the chat pod located in the lower left corner of your screen, then type and send your question that way. For optimal sound quality, it is recommended that you listen to the conference via your telephone. Please do not forget to turn off your computer speakers if you choose to listen over the telephone. Look at the top left-hand column and click the speaker icon to turn the computer speakers on and off. If you choose to listen to the conference through your computer speakers and you experience any problems with the internet sound quality, please dial back in on your telephone. I would now like to introduce our host for today's call, Steve Davis. Mr. Davis, you may begin.
Thanks, Karen. Hello and welcome to today's program, How New Technology Helped a Major Insurer Thrive on HealthCare.gov. Today's free webinar is sponsored by Softheon. I'm Steve Davis, Managing Editor of Inside Health Insurance Exchanges and the AIS report on Blue Cross and Blue Shield plans, both of which are published by Atlantic Information Services in Washington, D.C. Today we're going to hear about Softheon and some of what it does in the health insurance exchange world, and then we'll hear about Michigan-based Physicians Health Plan and its experience in getting ready to participate in HealthCare.gov and hit its 2015 enrollment targets. With us today are Eugene Sion, the founder, chairman, and CEO of Softheon, and Susan Armbruster, an operations consultant filling a lead operations role at Physicians Health Plan in Michigan. Their full bios are in your materials. You should have received an email containing a web link to the materials. That packet contains an outline for our program, slides, and some background information. If you did not get the packet, please click on the Presentation tab to the left of your screen. You will see a copy of the presentation materials that you can print out. After the presentations, we will open it up to your questions. And with that, let me hand things over to Eugene. Hi, Eugene.
Hi, Steve. Thank you very much again. We are absolutely delighted to be on this webinar, and I'm also more privileged to be joined by one of our esteemed colleagues, Susan. So we are very thankful for all the attendees taking the time, taking out of their busy schedules. We know how busy things are in marketplaces these days. Just now I got some few orders from CMS about some changing rules. So without a further delay, I'd like to thank you again for this opportunity to really kind of do a little deeper dive into some of our marketplace related issues, challenges as we see it, and then we'll spend some time with Susan and listening to her efforts and remarkable the capabilities that they have at the Physician Health about the marketplaces and more importantly their strategies. Again, I think our bios are included in the kits altogether too. Before we proceed, a little bit about Softheon. Softheon we are a 15+ year technology company located right here in the United States. Our development as well as our business operation and contact centers are all US based. As a core competency, we have been a technology company providing more of what I will call the ancillary components, just like the commercial, if you will. We don't make planes, but we make them safer for you. Over the years, we have worked with a multitude of sizes of organizations, of small regional health plans to the multi-state. And one of those engagements back in 2008, as my memory kind of recollects, when we did this project called Romney Care, as being one of the technology companies to put together the initial solution in place as the nation's first exchange, we somehow knew that the health in this healthcare industry in general, from services and delivery, will not be the same. It really change has been a up and coming, and with the mandate ACA, of course, that has accelerated, if nothing else. We have been fortunate enough to be trusted by 50 or so health plans, carriers that are currently in ACAs. And if you take that into the great context, there's about 400 or so health plans. And take the Tier 1 and Blues out of it, the equation, we are greatly kind of humbled and honored and privileged to be serving and working with these 50 health plans to bringing coverage to nearly 1 million lives. We will encourage the attendees to come and visit us online at Softheon.com. One of the things that we like to include you in our subscription. I know Steve and team have done a great job with your newsletters. Our newsletter is just a kind of a news aggregator for you for exchange-related events and activities. And we hope that you'll have a chance to subscribe and become really comfortable seeing your daily news alerts, if you will, in your inboxes as you come to work first thing in the morning. Our approach, as I mentioned that to you, is being somewhat of a little bit of a kind of a out of the norm, if you will, out of the box. Being one of the few technology companies that embrace the cloud technologies, what we have done over the last several years, starting with some of the early blueprints that we have gained and experienced with the First Data Exchange, we have built what we believe all the necessary critical components for the real-time consumer engagements. As this slide illustrates in here, that basically one of our core values is to be able to help organizations like Susan's to be able to extend and leverage their investment. These technologies, these investments that health plans have made over the last 10, 15, 20 years have been relatively successful. We have great respect for those organizations working and operating in such a small margins of revenues, if you will, with the pressures of MLRs and few others, and yet to be successful. So the key thing was for us, how do we extend and basically bring new life to these legacy, partially and administrative systems? And where we felt the biggest gap was basically the real-time consumer interactions. So let it be dealing with the members or employers or brokers, or in the ACA case with the navigators. Softheon was one of the companies that were the early adapters of what's called the rec-enrollment, which is basically our ability to create a plan-branded look and feel, and yet when the consumers are being prompted for their subsidy eligibility, we are able to talk to Federal Data Hub as shown on top right corner, the red block, if you will. And then obviously the real-time enrollment, eligibility, and all the way down to the ID cards tightly integrated with real-time premium billing per ACA, the binding invoicing, and then the full premium collections and so on and so forth. These challenges may appear to be maybe as trivial at first, but when you start getting into the importance of the processes and being available to the consumers, we as individuals very comfortable, many of us, I don't know, but probably most of the audience, as the in fact demographic shifts towards the younger population, they are more electronically savvy. They like to make their payments online. They like to go to online banking. They like to do their communications via Facebooks and Twitters and whatnot. So the same consumers are now being attracted through ACA and exchanges in general are simply expecting the same level of ease of use and same level of accessibility to those services and products. And so we felt that that is the area that we will be able to bring the value while we extend and leverage. As you shift towards the payment, electronic bill payment, presentment, and collections, again, these are the areas that especially the type of organizations that we feel that we have the strongest value proposition is don't really have the quote-unquote have the time or resources. For instance, we are a PCI Level 1 compliant organization. There are only 300 companies, organizations in North America is deemed to be PCI Level 1 compliant. So we have made an investment, and we are able to extend and leverage that investment across all our carriers. Of course, that is probably the single biggest differentiator. Our partnership with Bank of America enable us to establish 6 regional centers of processing for merchant and lockbox payments. Of course, we have subsequent plans and goals and objectives where the members are able to make their payments by money orders or being able to walk into a branch office making that premium payments by just simply seeing a cashier and paying for it in cash. Because again, the type of provisions that are in the ACA, along with the demographics that are in the ACA marketplace exchanges, it kind of requires you to do that. And just like everything else, that those 5%, 10%, even 2% of that population, it ends up creating 30, 40% of your workload, if you will. So our goal is to be able to mitigate all those risks along with anything operational, let it be fulfillment, mailing all those invoices. Even some of our carriers trusted us to do the ID cards and welcome kits. This way, we are able to take those hundreds of thousands of individuals and presenting that information in a single 834 on a single payment file to a carrier and making it the process almost no different than a large group, perhaps a Medicaid or Medicare-like implementations. So speaking of, if we were to kind of peel the onion and maybe a 5,000 feet view, if you will. So as you can see in this slide, I'm not going to spend a lot of time. One thing that's really is I think that noteworthy is if you look at the top right corner where we see the carrier. And I think this is testimonial to some of our value proposition. Early days, to be frank with you, our message was kind of question, and we do like that. In fact, one of our taglines, question every word we are saying in here. And again, when Susan speaks about their experience, we wanted to make this process as simple as possible. So we'll talk more about, of course, the kind of a deeper dive components about that, and we'll get into the specific parts of this, and we're happy to answer any question you may have during the Q&A sessions. We will make sure we have enough time to cover those. The word that we use, basically, Softheon is really the saver of health insurance exchanges. And those of you who travel quite often, I'm sure you have wondered every now and then, how does Delta Airlines basically provide all their flight information, seat, and price information to hundreds of thousands of consumer retail websites like Expedia and Travelocity. So our mission, to be frank with you, that is the industry we feel that we are to emulate, has been a successful. And that's what we have done. In Softheon is another term we use, the interstate highway system of exchanges. Our 15 plus years of experience working with every one of the core admin systems, from Facets to QNX to even Epic, we are able to connect these organizations and leveraging those investments and being able to basically take them to those, whatever the consumer market that is, federal exchanges, state exchanges, and now we're in fact moving rapidly into the private exchanges, in fact one of them being a brand of Softheon as well, Theos, is the web-based entity, which means basically in a kind of a simple analogy, if the HealthCare.gov is the Costco of health insurance, where a consumer can choose from 400 different product carriers and 80,000 different products, of course, depending upon what market that they are in, that the Theos in a similar way will be the Sam's Clubs or the BJ's, if you will, the same exact notion. Of course, we have some other ideas about how to bring sustainability, and we do encourage the audience to also look into the web-based entities as the step forward to sustainability of the private and especially the public exchanges. Again, that's perhaps another time for another presentation. Testimonial to our growth. We are exceeding nearly, I will call about close to 1 million lives. We expect to exceed that number by the end of this year. Believe it or not, we are still onboarding carriers that have done the first year implementation, second year they have seen a great surge in your memberships. Kind of one of those things, don't wish for it. If you get it, what do you do and how to do it? So we are in fact working with several carriers onboarding now 50,000, 100,000 lives in Q2, Q3 of this year. Our premium payment platform, I mentioned that to you being a PCI, we call it our PayPal unit, if you will. We are on our way to process nearly 500 million member premiums in 2015 alone. And again, you can see here that's basically a threefold growth in the member premium processing from the prior year. So this is the past and the present. Let's look at a little bit of the future. Again, I think the notion of marketplaces, there was a lot of the questions and a lot of uncertainty a year, 2 years ago. I think too we have reached a point that for sure the marketplaces are here to stay. We do know that prior to even ACA, the private exchanges, especially the shift towards the high deductible consumer-directed health plans, was a movement towards it. And kind of ACA in a way validated that information, but according to CBA, now again, these numbers are questionable perhaps to a certain extent, but they're expecting in excess of 20 million lives to be covered in ACA next year. Now partially because there are some other political ramifications, and as well as the increased tax penalties may drive that altogether, as well as some of the the large organizations. What we are seeing in general about forcing their part-time or minimum wage employees to the ACAs altogether. Nevertheless, whatever the number that might be, it is a growing trend altogether. And if you look at the employment base in the non-group, according to same, again, CBO report, by the way, the URL is also provided to you. And we are continuing to see a decline in those, which again, that basically simplifies or simply justifies the increase on the individual market on exchanges. All in all, between the private and public exchanges, there are a lot of reports that are floating around. From Accenture to the McKinseys, and again, anywhere from 75 million to 125 million, including Mark Bertolini, CEO of Aetna, quoted indicating basically he believes that there will be about 75 million or so people buying products on exchanges by year 2019, 2020. This is significant, and these numbers are as significant in contrast with any type of other government programs, entitlement programs, as the Medicare or Medicaid might be. And not to mention that, let's take into the context that Medicaid took nearly 15 years to really fully reach its current capacity. In its first several years, there was, just like today, there was, however, if you look into the ACA adoption, it has been significant, even to the point now the hybrid models like Indiana's Healthy Indiana Program 2.0 or Arkansas Private Options, even the politically challenging organizations or demographics, if you will, we're seeing the movement towards the exchanges altogether. And truly, again, whether or not these numbers are plus or minus 20%, we're talking anywhere from 80 to 120 million people will be on the exchanges. So what does that really mean for organizations that are health plans that have been very successful the last 20, 25 years? How do I make sure that, again, these organizations will continue to grow and thrive? The challenge is that basically the uncertainty or the unknown or the change is the only constant thing. So I took a little bit of kind of a 4 snippets over the last, I will say probably about a year's time frame. And it just tells you that the traditional processes, traditional common wisdom, if you will, has not really prevailed in this situation. And if you look into these organizations, these are very large organizations. Organizations like Oracle and Xerox, they don't really often fail. So it's not just the policy, it's not just about the process, it's not just about technology. So there are other elements. The challenges here that these organizations, and primarily states at the state or at the federal level, the timing was very, very interesting. They had an unlimited amount of resources and access to perhaps the funds that are available to them. Yet despite that, they have failed. Now the real kicker is in the case of, for instance, Oracle. We work with about 4 different health plans in Oracle that they had only about 3 months to move from their state exchange back to federal exchange. Same thing with Nevada. We had about 2 health plans there. We work with them very closely. So we take great pride of what we do, to be frank with you. One of the things that we always have Softheon, it's not what we do only or how we do it, but also why we do. Quite frankly, we feel the fiduciary responsibility helping these organizations making the transition so that we can help those the individuals that are looking for providing health coverage to their children, or providing coverage to their newborns, or to their husband and wives going through tough times altogether. So there is a little bit of a kind of added responsibility that we feel responsible. We feel that we need to be helping these organizations achieve, not on the short term or also long term. And I think the change will continue. As we know that in fact, Steve and I, we were just kind of chatting along prior to this event, that for instance, the Hawaii Exchange asked for some significant sums of money about operating their current exchanges. They only got a fraction of it. So once again, now that we all know what happened in the co-op space, for instance, that there's only 23 co-ops were able to receive their financing and funding, and once the sequestration kicked in, that basically kind of the chopping block came on them and no one else got their funding. So you need to continuously evaluate and assess where you are and how you want to modify. Now how do you do that in an environment that for the past 25 years has been very little change, very little kind of a diversity in the way two organizations operated in a highly regulated space, if you will. So that's really organizationally, we believe that the very first thing, that the good lesson to be really embrace agile organization, not just talking about the sprints and scrums, but the thinking, and more importantly about where do you really see yourself and your plan over the next several years moving into this process altogether. So the next slide is going to be about the data interfaces altogether, and how do we get basically into this process. And again, feeding to the agile organizations, that the one thing about the marketplaces in general, the data is flowing every directions and every possible ways, so that it needs to be responsive. As a health plan, you need to be responsive. Consumers might have been okay with, under the entitlement programs, not receiving their ID cards. Okay, I will go see my doctor maybe next week once you have me update my primary care physician information. Now, they are now a stakeholder. They are making a dollar payment, and that dollar payment means a lot to them. And they demand big things from the carriers in general. So technology has to be very agile. It has to be very responsive to these real-time data interfaces. Today we work with physician health plans and 50 other health plans where we get the information from the state exchanges, federal exchanges. We work with some multi-state health plans that we get data from so many different exchanges. And if you've seen 1A34, you've seen 1A34. As I mentioned that earlier, that unfortunately, despite all the the availability of the resources, every state pretty much decided to implement their own data standards. Every state decided to implement their own processes. So there is not a one common set of data. And your internal systems, every organization has a very unique, again, needs around how to disseminate that information. Master data management. We are seeing basically, especially this happened with one of our carriers, is they decided for their business reasons, of course we are there to support them, but to change their basically organization, their trading partner entity IDs with, they ultimately formed a new entity for marketplaces. Well, guess what happened as a result of that? Every member they had in 2014, when they re-enrolled for 2015 coverage, everybody received a new exchange ID. So in essence, we have no record about these people. So some of them, in fact, updated their demographic information. They have moved to a different location, so you cannot just simply find those people based on their last known address location. You need to implement a good, solid master data management platforms. You need to talk to the financial institutions in real time if you wanted to accept their credit card payments and being able to respond to the consumer saying that, okay, here's your ID card, real-time quote to card. I always tease around. I said, how successful do you think Expedia will be if I go there and make my reservations, but I have to wait 2 weeks to get my confirmation? I don't think they will be that successful. So I think those are the facts that we have to take into account in the ACA marketplaces and exchanges in general. And more importantly, I will call the analytics, the data. That drives the business. The organizations really have to be more data-driven organizations than traditional, perhaps as a risk avoiders. And the data, it's the primary source of course, the risk management. The approach has been very significant. Again, I know Susan will be talking to you a little bit shortly about their approach. So do you build that exchange organization, that technology stack, knowing that your state may actually say, hey, next you got 3 months to move to federal exchange? How agile your IT organization? Do you have the right vendors around the table? Do you have the right skill sets, right, the right consultants available? And some of you already probably have already had some problems with your families because you have been away so much around the open enrollment. The changes were coming. It's not just in onesies and twosies. It was coming in basically in bulks, if you will, and you had to make all these changes. And oh, by the way, you have other business that you have been running for the last 25 years. Let it be Medicare, let it be Medicaid, or small large group. So the cloud is a great answer to that because of its elasticity. System can grow with it, and more importantly, that organizations like Softheon, we are able to extend that and leverage that investment we make it one across all our carriers. And then we are able to provide you that excess capacity during open enrollments, or reduce that capacity and we can shift it to the other parts of our technologies. For instance, our broker operations, our private exchange, and our web-based entity operations. So we leverage that technology in the most effective and proficient way versus in the traditional methods of acquiring the hardware and sitting up there. Whether you use it or not, it just becomes an asset. But that asset, someone may question whether that is now a liability. Having said that, I think that we're seeing a kind of an adoption. Now, there are some, again, the cons of the cloud. Is it secure? Well, the answer is yes, because to the fact that, in fact, most of the clouds are being implemented with a lot newer technologies altogether. But more importantly, your vendors should be subject to your BA agreements, should be subject to SLAs, and more importantly, I will say, against any kind of data breaches of any kind, you're able to enforce those provisions very easily. Organizations have to take into account, again, as I said, you don't hear Delta CEO saying, we only want to sell it on Expedia. So as the carriers, as the health plans, you really have to embrace the multi-channel supply chain-driven healthcare delivery systems. Now, what does that mean? Basically, you don't want to open up every store, so you don't want to be responsible. You can, just as Apple, you may open up a store to build that brand experience, just as Delta has their own little website. But they are also able to push those products to so many different exchanges or consumer-facing retailers. We believe the supply chain transformation, the age is here today. Organizations are now needs to look into this thing as a holistic approach, not just a public exchange platform. An example, I'll take a minute or two. We have worked with another health plan that ultimately have purchased a complete different IT technology stack. Why? Because they felt that the risk was too high, too significant. And by also, they did not want to miss the exchange marketplace opportunity. They don't want to be one of the late ones into the market. So what they have decided to do is basically build up another IT technology, different skill sets, different operation controls. Now, is that a right approach? Perhaps. In our case, we think that that approach should be basically left to the organizations like Softheon. So we can be a wholesaler, so to speak. Let us be trusted with your products, and we will then basically push those products through every retailers, whether it's HealthCare.gov, state exchanges, or private exchanges. And since the cloud-based implementations, the vendors are positioned their business model, as well as Softheon, is a software as a service, so pay-as-you-go model, meaning that in our case, we are a success-driven organization. We don't win unless our carriers win, unless physician health plan signs up more enrollments. So it's a contingency base. So we are, for good or bad, a long-term partner to physician health and Susan. So my goal is to support Susan's organization every day and bringing creative ideas about how we can increase that membership. Not just on the operational side, running all those systems and sending out those invoices, dealing those HICS cases with CMS, but also to how we're going to grow the business. So our goal is to be able to help that sustainability about consumer markets in general. And we have a lot of creative ideas. In fact, one of them is our mobiles. We are heavily investing into the mobiles. We believe that's where the consumers are. You know, there are many, many statistics are being shared with you, and these numbers are already obsolete, as you know. You know, there are billions of searches are done on Google. People looking for, some will be looking for health insurance, and now those searches are being done on mobiles. So if they're on the mobiles, why would you want to let them go through really a poorly designed website? So, for instance, and again, what we have to do is in our world too is we call this minimum viable product. Our goal is to help physician health plans and get through the initial hurdle. We have now deploying and tackling different areas all the way from responsive websites to the native mobile application that consumer can actually make a payment. As they make a payment, we can keep track of their locations and so on and so forth. So if I may summarize it, exchanges, marketplaces in general is not a project. It's not an IT engagement. It's not another federal government program. It's the change. It's the change, the paradigm and transformation sweeping through the industry right now. We're seeing a lot of the, I'll call a new next generation of JetBlues that are being formed, organizations that, successful co-ops that we had the honor and privilege to work with some of them, to organizations like Oscar Health. We are seeing great amount of innovation kind of come into the space altogether. And this gives a great opportunity. Doesn't matter what size and capacity you are. This is the time, this is the opportunity to truly the leapfrog from where you are today, where the industry, where the, in general the nation is going to be. One thing is for clear, 18%, 20% GDP on healthcare is not sustainable. So using the technology, using the information, using some of the innovations that are both in the business models or on the technology side, we are again proud and privileged to be a partner with Physician Health Plan. So without a further ado, I will turn over to my colleague Susan, and she will be talking about her experience working with Softheon in general and perhaps ACA challenges and her accomplishments. Susan?
Thank you, Eugene, and good afternoon, everybody. Wanted to just take probably about the next 10 minutes and go through our experience with Softheon as we implemented the exchange, the federal exchange for individual members this past January. So one of the challenges PHP had was, number one, we're a small organization. So, you know, the funding is not, you know, unlimited for new technology. There are limited resources to install new technology. And the real challenge we knew, was we had just completed a major system a version upgrade in order to support the exchange. We completed that, went live September 15th, and then had to enroll members on the exchange 11/15. So literally we had about 2 months to get the Softheon system installed and functioning and ready to enroll members. We knew that our core system, our core claim payment system, did not handle multiple member transactions on the same day for the same person. And we knew from hearing from other folks that many times people signing up at the Federal Exchange would select a product, decide they wanted something different, and it was possible that you could get multiple transactions on that 834 from CMS for the same member on the same day. And our system did not handle that very well. So one of our requirements was we only want to bring in members who are effectuated. In other words, they have made their initial premium and they're truly going to be effective when they come into our core system and we're ready to pay claims on those members. In addition, we had never produced an outgoing 834, which was one of the CMS requirements. We did not have the capability for individual members to make premium payments through a web portal, so we needed to have that functionality available. And we didn't have time to modify our member notices to include the itemization that's necessary for the subsidized members. So on their invoices, you have to show what their portion of the premium is and what the federal government subsidy is. It has to be itemized. So those were the challenges we had. We did have a wonderful person in our compliance department that was able to speak to Softheon at one of the seminars she attended, and that's how we got Softheon's name. And quite honestly, we did not find a lot of other vendors out there that could meet our business objectives as quickly as Softheon was able to. So let's go to the next slide. So basically we were able to install Softheon and we were ready to enroll members 11/15. Now we continued to pay claims in our core system, and what we wanted was the information coming over for effectuated members, and we wanted Softheon to handle all of the premium billing and payment posting, and then we wanted to bring all of that payment information into our core system. That, as you all know, kind of facilitates the shadow processing of the claims, and it facilitates the grace period if that has to be applied to members. But if we looked at the functionality, the time frame to install was less than 90 days. We were able to go live in about 60. We had all of our provider networks and all the proper linkage that we had on our website. We were able to scrub the 834 coming in from CMS so that we only were bringing in effectuated members. There were also 991, 999, and TA1 transactions that had to go back to CMS that we were not, we were producing the 999 but not the TA1. So there were some additional transactions that had to go back to CMS that we were not currently producing. We talked about the invoice modifications. We needed the public portal capability. We needed that up and functioning quickly, and that was built very successfully. We wanted the support of Softheon in the reconciliation of these members, and that's probably one of the areas where we paid particular attention, and we really mapped everything coming in from CMS to Softheon to our core system, any file coming in and any file going out, and we tried to reconcile those three applications on a fairly regular basis, not only in terms of member counts, but also in terms of dollars going back and forth. So we are now looking at possibly bringing up the private exchange for this coming open enrollment period. Okay. And that is pretty much our experience with Softheon. I will say that the support folks that we worked with in terms of their project managers were very accommodating. The information that we needed to supply back to them was very well documented, and I think because we had filed our templates with the Michigan DIFS department, it just, I can't tell you how easily this came together. Now, like any system, there is a learning curve, and we are still fine-tuning our knowledge of the system, but it, compared to a major claim installation or managed care integrated system installation, this was very simple.
Great, thanks, Susan. And how many? Can you give me just give the audience sort of an overview of how large of a group of Physicians Health is?
Yeah, we are a small regional health plan. We have about 80,000 members right now. Our strategy was to move into the exchange space very slowly, so we started out with just individual HMO plans last year. We actually have about 1,500 members at this time, so I think the slow approach and strategy has made our lives a little easier in terms of all of the financial and membership reconciliation that we had to do. And you know, I think we've built the proper framework to grow in this market now. So.
Great. Are you on SHOP as well, or is it individual only?
No, just individual.
Okay, good. Well, Susan and Eugene, thanks very much for your presentation, and now I'm going to ask Karen to explain how to ask a question. Karen?
Thank you. To ask a question via the web presentation, select the chat pod located in the lower left corner of your screen, then type and send your question that way. If you would like to ask a question via the telephone, please press *1 on your phone now, and you will be placed in the queue in the order received. If your question has been answered or you wish to remove yourself from the queue, please press *1 again. I will announce each caller prior to bringing you into the conference. Please remember that if you have your phone on mute, take it off mute when you're selected to ask your question. Again, to ask a question via the web presentation, select the chat pod located in the lower left corner of your screen, then type and send your question. Steve, we're now ready to begin.
Great, thanks, Karen. We've got about 15 minutes for Q&A, and let me get started. A question for Susan. Just you didn't participate in the exchanges the first year, which was probably a good thing. How close were you to not participating in the second year?
We definitely had to move forward the second year. The first year, I think it was a good strategic decision to kind of sit back and wait. It gave us the opportunity to get our core system upgraded so that we could support shadow processing and grace period management and all of the requirements related to the exchange. But it was without a doubt a strategic objective to be in the exchange last year.
Okay, great. And Softheon came into the mix about 2 months prior to the open enrollment season kicking off?
That is correct.
Excellent. And Eugene, one thing you mentioned that I wanted to ask you about was just the security of the cloud technology. And how do health plans ensure that what they're dealing with is secure and the data is secure in the cloud?
I guess, do you want Eugene?
Yeah, I was throwing that one over to Eugene.
Go ahead.
Okay, sure. I think the number one is foremost that we make sure that our SLAs and our BA agreements, so we're contractually, we are not a stranger to the quote-unquote our roles and responsibilities. The things that we do among just being the certified SOX compliance or other type of compliance, let it be. For instance, we conduct on a regular basis our own penetration tests. We have engaged firms that, of course, I cannot publicly give them who they are, what they do. They are attacking our systems on a daily basis. We take this thing very seriously because the last thing we want to be, the the kind of the front page of Wall Street Journal. Unfortunately, so it's not a question of, in fact, your prior investment you made it, but it's more so that designing the system from ground up with this kind of threat, with that kind of uncertainty in mind, and putting the right controls and the right metrics are in place. So of course we do general assessments as we do this, what we call it a pen test, penetration test to our systems altogether by third-party entities every 24/7 by day of the week. It does not matter for us. So we want to be able to, again, safeguard the information. Architecturally, we love that conversation to sit down when we sit down with Susan and team on their IT team. Our systems, whatever the consumer-facing systems, for instance, it contains zero data in a recorded fashion, meaning that everything about a PHI data or PCI data, it stays in memory, meaning even if there were any kind of a malware, the computer resources at that time will basically only limited to what's in memory. So we do a lot of safeguarding, and I don't want to talk a lot on this context altogether too. But can rest assured that we have the proper measures and controls as well as the governance in terms of our contracts are concerned about safeguarding and protecting the data.
Okay, good. And a question from the chat pod, somebody asked, does Softheon own the data, and in parentheses, warehouse, or does the carrier own the data?
No, without a doubt, our carriers own the data. In fact, our technology, unlike any other cloud-based technologies, unlike Salesforce.com and few others, we are not what we call the multi-tenant, meaning that we don't share the same data repository across multiple carriers. Every carrier have their own IT stack, from a database to the application server to the presentation server. It is always, always our customers, our carriers' data. With their consent and approval, we do a lot of data mining. We do a lot of analytics. I've shared some slides about that, from heat maps to the few other metrics altogether. We are the trusted entity with some of our carriers to do their edge server implementation. So we also host any kind of a claims-related data, and we do report that into CMS on a regular basis. And so we safeguard that data on behalf of our carriers at any given time. And in fact, one of our interfaces, I'm not sure that we can talk more about, we also provide enterprise data warehouse. We encourage and we like to basically stand ourselves to the highest standards. We want to be totally transparent. So we provide enterprise data warehouse extract that includes the people not just effectuated, but people that are still in transition. As Susan pointed out, the health plans don't want to see that member until they make a payment, because once again, there could be people coming in and out. To Susan's point, you don't want to be bloating up your existing admin system, for people may never come back to making that payment to effectuate them altogether. So for that reasons, we keep all the data, but those data elements available to you as an EDW. It is also available to via our secure web APIs. Just as today we talk to CMS through secure web APIs, web services, SOAP calls. Again, don't want to get too far into details. And we do provide those API capabilities for our carriers if they wanted to do, should they wanted to do a transactional interfaces like single sign-on. Some of our carriers have a well-established member portals. What they want is just a snippet of that member data. They can get that data through our web API or simple single sign-on transaction interfaces.
Okay, great. Thank you. Another question. I'm just going to read this one. It's a pretty long one. When a member enrolls, pays the initial premium binder payment via the health insurance exchange, what does the member receive upon the completion of that transaction? Proof of coverage with the particular health plan that they opted into? And that's the question.
So, Susan, would you like to answer it, or I will keep going otherwise?
Yeah, I can go ahead. So yes, so once the member has paid their binder premium and they become effective, they're going to get a new member enrollment packet like any other commercial member would get, that includes their summary plan information as well as a full COC and ID cards and everything else they need to access healthcare.
Good. Did you want to add to that?
Yeah, and to add to that is I'll go a little below than what Susan said. So that's what the overall business experience from a consumer point of view. In the technology side, basically the members will receive a confirmation number from Softheon when they make a payment, because most of the exchanges are actually, including the FFM in Susan's case for physician health plan, we are the payment portal. In other words, the consumers are redirected from healthcare exchange to Softheon payment platform, which is, by the way, totally branded with the physician health plan. For a consumer, all they know is right now they're in the physician health plan payment portal, if you will. We then keep that confirmation number and then ultimately match that to an 834 that we may receive the subsequent day or the night, whatever that might be, from the respective federal and state exchange entities altogether. Once we receive the data, and that data will have that transaction ID in it, and that ultimately then enables us to marry the payment information against the 834, full reconciliation, changes subject to the business rules, as Susan pointed out, then making sure meeting the binding payment conditions. Once we do that, the members are in essence quote-unquote effectuated, and then we pass the data to physician health plan in this case, and they will handle that welcome kit ID card generation, as well as now that members' claims can be paid effectively in their core admin systems.
Great, thanks. And another question for you, Eugene. Do you integrate with existing structure or create a new one? What is the typical lead time for implementation?
Well, as Susan pointed out, that 60-day includes any kind of infrastructure needs. We as a cloud-based technology infrastructure, we are able to very easily provision any necessary hardware or software is needed. And on that note, by the way, we maintain 2 environments for each carriers. We call the production environment for all the right reasons, and we also maintain what we call a model or test environment. To us, that is a production as well. As we do our nightly, sometimes, most of the time, these days now, back to the weekly or states, but we do have a nightly upgrades and changes that we make it, and we make those 2 environments altogether. So we basically stack up those 2 environments as part of our onboarding experience, and that also happens within that 60-day time frame that Susan has experienced. And there are some cases that, by the way, we were able to do that in 30 days. But there are some complicated cases where some historical data, or maybe our carriers are a little bit more diverse, if you will. We have organizations are heavily invested into the small group brokerage-based consumer market, if you will, rather than ACA. So every environment is a little different, but our quote-unquote the standard environment altogether, basically it's all part of that 36 days commitment, if you will, and we are responsible of course making that happen per SLAs. If we don't get it up and running, we are perfectly fine and agree to the terms that are, we understand the importance of getting those environments up and running on a time basis. So short answer, 30 to 60 days, it is part of the environment.
Okay, great. And Susan, what was your experience? You did that probably quicker than most would, right?
I think it was fast in terms of system implementations that I've experienced throughout my career. And I think a lot of the information that we needed to have on our website had already been prepared. Of course, we had filed all of our plan designs with the state. It was the 834 piece that was, really a challenge for PHP, and I think Softheon had so much experience in scrubbing that data and presenting us with a clean file. It made that load into our core system so much easier than what we would have been dealing with had we taken it directly from CMS.
Okay, good. And Susan, we talked a little bit offline about PHP looking into a private exchange. Can you talk a little bit about that?
Yeah, we are looking right now at using Softheon for a private exchange and having that up and functioning by open enrollment period for this year.
Excellent. And another question, on plan management channel, does this include all areas such as case management and disease management?
No, it is only the products themselves.
Okay.
So the case management and disease management is really a function of, data mining to identify those people within your population. And that information is done through our medical resource management department, and they put programs together that are required for our population as well.
Okay.
And that's a great question, by the way, too. I'd like to also add a couple of comments to it. This, again, speaks to our value proposition. We don't want to reinvent the wheel. We don't want to, we don't want to try to unsell or undo things. Every health plan, to the best of our knowledge, that have built processes or has procured those investments, they made the investments. So we believe those capability functionalities is a critical part of the core admin system and should stay in the core admin systems. Our goal is to really closing the gaps between what is there versus what needs to happen for the consumer-driven marketplaces altogether. So we consciously made a decision to not to bring those functionalities into Softheon world. Instead, we highly encourage it to extend and leverage those investments made by the health plans.
Okay, one more question for you, Eugene. You quoted Google mobile strategy. Does this include SEO and SEM or existing and or new carrier website? How about chat?
Absolutely, absolutely. So it does include let it be any kind of because again we are incentivized. Softheon is a stakeholder, is a partner to physician health plan. So we'll make every effort to create the visibility for PHP in the general marketplaces by helping them with their basically the marketing efforts all the way from optimizing the search engines. Our website already has embedded analytics component to it. We are able to leverage those components across so many different channels because we wanted to be able to generate that quote-unquote awareness in the general consumer markets. So we work very closely. In Susan's case, we really didn't because we didn't have too much of a ramp time, so to speak. But I think that as we transition into the private exchanges, we work with our carriers about, how do we brand, how do we build together these websites that actually, again, is a reflection of PHP and the values that they represent and present. So our goal is to be able to bring that ability, technology, the know-how, and so that just basically Susan says, okay, go make it happen, and we are able to execute on that vision. Conversely, we bring values from our best practice perspective by working with so many health plans differently. We are able to bring certain values. For instance, our biggest focus now, building really the very robust broker engagement operations. We feel that that is a very unique value, and it could help the health plans differentiate. So we are, again, working with so many of our carriers about building those operations as a continuous value proposition so that we can help those, quote-unquote, once again, direct-to-consumer, let it be through mobile apps or let it be through traditional web methods. We are a data company. We are an analytics company. We love looking at those numbers every day in and out. And to be frank with you, that is our core competency. So we let Susan to run the operations and just tell us what needs to happen. And we are absolutely delighted to be part of her team to get the, again, physician health plan realize and achieve those goals they set up themselves.
Excellent. Well, we are at the top of the hour. I'm going to just ask you both for closing comments, if there's anything that you'd like to add.
I'll turn over to Susan.
I think coming into PHP, I did not have a lot of experience with the healthcare exchange. It was a steep learning curve for me. Getting with Softheon and having this smooth of an implementation made it seem so much less daunting than it was initially.
Excellent. Eugene?
Well, again, I think that I will say these are exciting times. There are a lot of exciting things are happening in the space, and I think that whatever happens today, we'll continue to be talking about it if nothing else. And we are absolutely delighted and honored and privileged to be working with Susan and so many people like Susan and that have trusted us. And we believe that through the innovations and creativity and genuinity and the thoughts, so to speak, that through this kind of a creative process and innovation, if you will, we believe that there is an overarching goal for us and for our health plan, and we are absolutely delighted to be part of their futures, and we love growing with them, and just hope that they are also excited about us. And again, every given opportunity, we are there to kind of step up to the challenge and bring some value to the table. And we again thank you for you, Steve, and your organization. Truly, we have great respect for you and your team. We always view that you are the kind of a non-biased, very objective opinion you render, and truly, again, we are delighted to be in front of you and your audience. So with that in mind, thank you again one more time.
Excellent. Thank you, Eugene, and thank you to Susan. Some great questions, too. And once again, I'd like to thank Eugene Sion and Susan Armbruster for their insight, and I'd also like to thank our audience for your participation as well. Thanks very much, everybody, and have a great afternoon, and goodbye.
This concludes today's webinar. Thank you for attending.